Hi, my name is Amy Perlman. I am a urologist.
I'm Nicole Nisly. I'm an internist.
Awesome. Nicole, tell me about where this LGBTQ clinic initially started and where do you see this initiative going?
So I heard from a group of students at my university that they had a terrible time finding a place where they could see a doctor. They were transgender identified and they said, I don't know if I go to this specialty or that specialty. Every place tells me that's not the right place. So I don't know where to go. So at that point, I'm a general internist, a primary care physician, and I felt, primary care is specially suited to create a home for the community. And I felt that the best antidote for not knowing where to go, for a barrier to care, is to create something very visible. That's your place. But not being LGBTQ or transgender identified, I felt that I needed the community to tell me what do they need. So we reached out to the community and they were very generous to tell us and share their wishes, what they think we should do. And we quickly realized that we needed more than medicine as part of the team. For example, people needed to change their gender marker on their birth certificate or their name. We needed counselors. So we reached out to our colleagues from multiple specialties and the clinic was born. Today, we have over 2,000 transgender patients. We are in the Midwest. Many people felt that we would hardly find a patient, and we have a very large practice. So I would say that this model of patient-physician collaboration and multi-specialty collaboration, but most especially people that care passionately and to create a space where our patients feel safe and welcome, and we can have a place that you can call your own.
Yeah. Well, thank you so much for all the work that you've done to build this clinic. I'll tell you, when I started at the university a year and a half ago, I was interested in doing some of the transgender surgery. But just because I want to do something, Nicole, doesn't mean that I can. There's so much that goes into the infrastructure of providing the basic care for these patients that I can't do the surgery unless that infrastructure is there. So the work that you and your team has done has made that the easy part about my job.
So, it's a team of many, many people. I always feel like this is really a team and it's a community effort. So from the schedulers to the IT people creating more pronouns, gender preferred name, to our leadership, to the front desk creating a welcoming space, that first person you meet. So I think this place has so much potential and it can be reproduced in other places. That's our goal, is to see it not be unique to Iowa or to wherever we are, but to anywhere that you are.
How do you hope to expand this team in the next 1 to 2 years? And where do you see this team being in like 10 years?
Sure. So first of all, I think this would be a dream space to practice.
I would agree. I'm not from the Midwest, and I think it is the dream space.
If you are a surgeon that just finished your training and you have a large group of LGBTQ identified, in particular transgender identified, they have a strong primary care presence. They are from our community, from nearby communities. We have all the subspecialties providing support. We have legal help. We have counseling. The laboratory set up to use gender-specific normal values, for example. And we have a number of screening practices that are not commonly found. My goodness, what's not to like?
I don't know. And then tell me a little bit about your ideas for this prospective registry.
So the Institute of Medicine has determined that there is not enough data. We don't know enough about the health of the LGBTQ community. They established that the LGBTQ community suffers from health inequalities, and they have called to action, all of us, scientists and faculty, to try to collect more data to understand the health of our patients. So I feel that, again, we have a very large group of transgender identified patients, and I'd like to know more about their health. What happens if you are trans man identified, trans woman? What about if you're gender queer? What happens if you're gender fluid? What happens in 10 years from now, 20 years from now? We are extrapolating the data for cisgender people to the community, but that data simply doesn't exist. So I think it's an amazing opportunity to create knowledge, education, and to really to know more about the community.
Yeah, so growing the field, growing the team, pushing the limits, and really just taking care of our local, regional, national, and international community.
Absolutely. And I think, we always talk about health disparities, and we, for years and years and years, we teach about it, we present about it, but my pet peeve is, what are we going to do about it,
Right.
And so to me, this is a model that can actually work for other communities too.
Yeah.
It has worked so well. Why not also expand to other communities that have experienced health inequalities, but in a very practical way, know that they are experiencing inequalities. How can we make that equal, make the field more safer, welcoming, and so on?
So folks, there you have it from Nicole Nisly, who is game-changing medicine and improving lives.